Having a smear test. What is cancer? And what is a cancer screening? Cancer is when the cells in our bodies go wrong. Cancer causes growths or lumps in the body. We are going to talk about having a cancer screening. This means a special test you can have to make sure that cancer is found early and to get treatment as soon as possible if you need it. HPV means the human papilloma virus. It is a common virus that does not cause any problems for most people. But some types of HPV can make the cells in the cervix go wrong. For a small number of people with a cervix, HPV can cause cervical cancer. This is why it is important to get your HPV vaccine if it is offered to you. This is also why it is important to attend your cervical screening, also known as a smear test. A smear test is not a test for cancer. It is to find changes early before they turn into cancer. It is taking a small sample of cells from the cervix to check for any changes. Who needs a smear test? People who have a cervix are offered a smear test from the ages of 25 to 64. If you have had sex with a man or a woman, you should think about having a smear test. This means any kind of sex and any kind of sexual touching. If you have not had sex, you can still have a smear test. Every person with a learning disability who is registered as female should think about having a smear test. Booking an appointment. You will get a letter in the post asking you to go to your doctor's surgery for a smear test. You will need to call your surgery to book a time and day for your appointment. If you need to arrange a visit to the surgery to meet the nurse beforehand, you can ask for this. You can ask for adjustments to be made for you, like a longer appointment. You can ask someone to come with you if you are worried. Book a day when you are not having your period, as this makes the test easier. A female nurse will complete the smear test.
On the day of your appointment, make sure you bring your invitation letter with you to the doctor's surgery. Check in at the reception and wait to be called by the nurse. Once in the room, the nurse will explain what is going to happen. Ask questions if you don't understand something. The nurse will check you understand and will ask for your consent before starting the smear test. You can stop at any time if you are worried.
Equipment used in a smear test. The nurse will show you the equipment before you start the test. A speculum is a special tube which goes inside the vagina to keep it open. This is because when you have a smear test, your nurse needs to see into your cervix, which is inside your body. The nurse will use some gel to make it easier and feel more comfortable when the speculum goes in. Once the speculum is in, the nurse can see your cervix, and they will use a small brush to take a sample of cells from your cervix. Having the test. You will be asked to undress from the waist down. It may be easier to wear a skirt or a dress, so you only need to take off your underwear Try to relax. This will make the test easier. The nurse will help you to get into the right position on the couch. The nurse will talk to you about what they are going to do and what to expect. You can stop at any point if you are in pain or feel uncomfortable. Your friend or carer can wait with you if you want them to. The nurse might offer for another member of staff to be there. Once the test is finished, you can get dressed. The nurse will let you know what will happen next and how you will receive your results. You can ask questions if you aren't sure about something. If you aren't able to complete your smear test, this is okay. You can talk to the nurse about what might make it easier for you next time. You can always try to do the test again on another day.
After the appointment, you will get a letter with your results within 2 weeks of your test. If you don't receive a letter, then contact your doctor's surgery. If the result is normal, then you don't need to do anything. You will be invited for another smear test every 3 years up to the age of 49. Then from 50 to 64, it will be every 5 years. A small number of people will be asked to do the smear test again, or might have to book an appointment for more tests at the hospital. Your letter will tell you what to do. If you don't understand your letter, you can ask someone to read it with you. If you have any problems with your smear test appointment, you can also speak to your local learning disability team or your doctor's surgery. Joe's Trust also have a helpline you can call if you're worried or have any questions about your smear test. 0808 802 8000. Thank you for watching.